Good evening. Today we are discussing psychoanalysis and psychotherapy. Psychotherapy. The word psycho or psyche refers to the mind. Psychotherapy refers to a range of psychological based treatment which helps to overcome psychological disorders or psychological maladjustment. Basically, the psychotherapy has given much more importance for the individual's past rather than the present. It gives more importance for individuals' early life experiences or childhood experiences, which form the basis for the development of individual personality. So it emphasizes on insight rather than the change. In a sense, there is a slight difference between insight and a change. Insight refers to a client will try to look at his own problems and he tries to overcome that problem. So technically it is referred as an insight. So there is a slight difference between insight and a change. It is not a drastic change which is going to happen. Rather, it's a gradual a change through its process where individual tries to understand his own problems and he tries to overcome it. And at the end of the therapy, we, as usual, we find a detachment. A therapist detached from the client. So in this psychotherapy, the role of a therapist is more an expert. He's not just a listener, rather he's an expert. The essentials. What are the essentials of a psychotherapy? Psychotherapy is mainly a systematic interaction. It's an interaction between a client and a therapist. And the mode of interaction may be like verbal and non-verbal. And initially, the therapist tries to understand the client's background, like social background and the cultural background or the cultural environment. Then there are certain psychological principles which are involved in the psychotherapy. If a person wants to be a therapist, he has to understand the learning theories, he has to understand the theories related to the personalities. And the focus of the psychotherapy is thoughts. It focuses on individual thoughts, feelings, and behavior. And mainly it focuses on individuals' emotions, because individual emotions are what do you call the strongest things which moves an individual. And a therapy, the question of therapy arises only when there is some sort of psychological disorders or some sort of maladjustment. So when we say it's psychoanalysis, it's a method through which we analyze the psychic phenomena or the mental process. It is mainly, we use psychoanalysis to treat like emotional disorders, like anxiety disorders, anxiety, depression, and other emotional related disorders. And in the process, a client is encouraged to talk freely about his past experiences or the person experiences and dreams, because these are the things which gives clue for the therapist like what actually the problem is with an individual. If we look at the application of psychoanalysis, it is applied in various fields. Basically, psychoanalysis is used to investigate the human mind or the psyche, and it is used to understand the human behavior, and it is the basis on which many theories are formed. And by having the knowledge of the psychoanalysis, we can treat a person with psychological problems or a person who is suffering from certain maladjustment. So when you say it's a psychoanalysis, we have to focus first on the structure of individual personality. Sigmund Freud uses three construct: id, ego, and superego. They are the construct, they are abstract, through which he tries to understand the totality of an individual personality. And the id, the construct id, works on the principles of um, like gratification. It is like an animal instinct. It works on pleasure principles. And the ego, it works on reality principles. And it has got the role of regulating the impulse of id. And when it comes to superego, it's an ideal construct, or it is framed by the individual social, cultural, or ethical atmosphere, which influence the development of superego. When id, ego, and superego, when all the three things are in congruence, then there will be a proper development of the personality. When id try to overtake the ego, and when ego subsides, when there is a disequilibrium between id, ego, and superego, there will be a maladjustment, there will be certain psychopathology, there will be certain problems with an individual. So what he says is there is a need to balance the proper working of id, ego, and superego. And when we fail to fulfill our desires, or when we fail to fulfill our wishes, it is repressed, or it is pressed inside the individual's unconscious mind. There it works and it influences the individual's personality. It also, the repressed desires also leads to mental disorders or maladjustment. It mainly occurs when there is a intra-psychic conflict. We say intra-psychic conflict when there is a disequilibrium between id, ego, superego. When there is a conflict between id, ego, and superego, we call it as a conflict or intra-psychic conflict. It occurs, the repression occurs due to this sort of conflict. When there is a conflict and it's the ego which comes into play, it tries to protect itself from anxiety by using the defenses, which we call it as ego defense. In the Freudian thought or in the psychoanalysis, we mainly see how the unconscious, he mainly emphasizes on the past of an individual. He says it's the past which lay the foundation for the present. And whatever happens in early childhood will certainly influence the person, influence the development of personality in the later stage. And what is there in unconsciousness, whatever we perceive, whatever we think, whatever we feel, and whatever the unfulfilled desires, wishes, and everything is repressed in unconscious as a drives, and they keep operating and influencing the individual personality. It is a theory, psychoanalysis is a theory which describes the structure of the mind. As I told you earlier, the structure of the mind or the psyche is like id, ego, superego. This is the structure of the mind. It explains the structure of the mind and the development of the personality. The personality can only develop when all the three things, id, ego, superego, all the three things are in equilibrium, or all the three things are in congruence. Only then there will be the development of personality. When there is a disequilibrium between the three elements, we certainly face the problems like psychopathology. You can call it as a psychological disorders or maladjustments. So it's a technique through which a therapist tries to treat certain psychological problems. It is also is a method. We can call it as a method of scientific investigation based on clinical observation. This one is based on a clinical observation. It is not that we take some statistical data and come to the conclusion. It treats each and every individual and every case as an unique. Based on the clinical observation, they come to the conclusion, they try to understand what exactly the problem of an individual. When we look at the evolution of psychoanalysis in the first phase, the psychoanalysis mainly focuses on the human mind, like the unconscious thought. Unconscious thought mainly consists of the dreams. Like we can access the unconscious thoughts, desires through dreams, through hypnosis, through free association. I'll come to this one later. Okay, unconscious is almost like 70 to 80%, and the conscious is almost like one or 2%. And many a times we are in unconscious states, and it is the unconscious thing which influence the individual consciousness. And if you want to understand, or if you want to understand the individual personality, we use the dream analysis, we use hypnosis, we use free association in order to understand what is repressed in individuals' unconscious thoughts. So in the first stage, the focus was on unconsciousness, but was mainly on the dreams, on the hypnosis, and on the free association. Later, in the second phase, they gave more emphasis on the free association. Free association is nothing but there is a relationship between a mental events. When I say red, you think of a blood. When I say white, you think of a whiteboard. So there is a association between mental process. So through this method, he tries to access the individual's unconscious level and tries to bring the repressed thoughts, emotions, feelings to the conscious level, and tries to overcome the individual psychological problems. This is in the second phase. And in the third phase, or in the third stage, he work on dream analysis. Dream are nothing but like it's an expression of individuals' unfulfilled desires or wish in unconsciousness when the person is sleeping. So there are a lot of interpretation with regard to dream analysis. So he describes it as a primary and a secondary process. In the primary process, it is the id or the pleasure principles or the illogical principle which dominate the individual's dream. In the secondary process, it's the reality principles or the ego which influence the individual dreams. So individual dreams are expressed, or the dreams are an expression of individuals' repressed emotions, thoughts, and feelings when individual is in unconscious state of mind. Then at the third phase of psychoanalysis, Jung, Adler, Horn, Sullivan, Erickson, they modified and they contributed for the development of psychoanalysis. When you look at the work of a psychoanalyst, what exactly the psychoanalyst carry out the work. I mean, if you look at how he operate, first, like counseling, he tries to establish an alliance or the rapport with the client. Then he tries to collect a certain information, background history, like his social background, his family background, education background. By understanding, by looking at the background or the history of an individual, the psychoanalyst can fix the problem. He can see where exactly the problem lies. Then he, after fixing the problem, he tries to explore certain precipitating events. There are events which trigger the individual problems. So he tries to look at what are the precipitating events. And he also looks at the resistance. In certain cases, individual develop defense. He is not in a condition to express or respond to certain questions. That shows that there is some sort of defense, there is some sort of resistance which is happening at the unconscious level. So by understanding the individual's precipitating events or the resistance, the psychoanalyst tries to overcome the defense, and he tries to increase the client's awareness, or he get the clients to have an insight into his mental conditions. So exploring the client's transference and monitors the therapist counter transference. Look, even the transference, counter transference or transference, both are emotionally loaded. It's an emotional relationship which helps the therapist to understand the problems of a client. It examines, as I told you earlier, it mainly focuses on the past of an individual. In Rogers' theory, we see the focus mainly on the present. Even in the Gestalt theory, we see the focus is mainly on the present now. But in case of Freudian psychoanalysis, he stresses more on the past. He says past is a treasure through which he can mine whatever it is which is repressed right from his childhood, because these are the things which causes the problem. When 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 a therapist through the stages tries to access this unconscious stage, he tries to bring the hidden thoughts, emotions to the level of consciousness through what you call this, through free association, and gives feedback and negotiate with the client regarding how to overcome the problem. So here the psychoanalyst is not just a listener. Here he is an expert, and um, and and for everything there is a termination after, when the problem is solved and the client is doing well, there is a stage of a termination. So there will be a follow-up. So in this format, like a counseling, the process goes on. Then when we look at the techniques of psychoanalysis, the process of psychoanalysis develops in stages. It is not haphazard, it takes place in stages. First thing is maintaining the analytical frame, like following certain procedures. You are like a therapist is regular, he's consistent, and he concludes the session and he gives certain suggestions, and the system, the framework itself is a therapeutic for the client. Then the second technique is a free association. Like as we discussed earlier, free association is nothing but there is a relationship between the mental events. We can understand this one. Mental events, they are meaningfully associated with each other. As I told you, when I say red, we suddenly say it's a blood. When I say white, it may be paper. Like based on your past experience, maybe better experience or bitter experience, you tend to recall it. It's a free association. You can recall it. So client freely, it gives an opportunity for the client to recall his childhood memories or the past experiences, so that the client can bring his unconscious or repressed thoughts and emotions to the conscious level, and he can work on it. Then the other technique is dream analysis. It was proposed by the Freud and Jung. This analysis, when we say it's a dream, it's an expression of whatever repressed desires or emotions which are repressed will give and vent, or is expressed when person is unconscious state of mind during sleep. So, and here the therapist analyzes the content of the dream. Dreams are in the forms of symbols. Sometimes we get the dreams of a snakes. That has got a different meaning. Sometimes a person get the dream where he see only the dogs or cats. So each and every animal or every symbol has got an unique meaning. So it depends on how how the therapist analyze it. And the next part is the interpretation. Interpretation helps the client to understand what actually the meaning of the past or the personal experiences of a client. Then he explain the dreams and the free association to the client. It helps to understand the unconscious motives and impulses. It may start from surface to bottom for deep, or from deep to surface. Then the analysis of interpretation of resistance. Resistance in a sense, anything which prevents the client to produce unconscious material to the consciousness. We can call it as a resistance. Anything which resists you to express your unconscious thoughts or emotions. So client resist to bring unconscious material to the level of awareness. So why the person is resisting? The main cause is you want to avoid getting anxious or pain. Certain things, certain unpleasant things or certain painful things, when we recall them, we tend to suffer. So in order to avoid that, in order to defend, we use a resistance. So therapists even respect the resistance of the client. See, when there is a resistance, the therapist analyzes the resistance. Resistance indicates that there is some sort of defensiveness, and it indicates that person or the client is not willing to express it because there is some sort of anxiety arousing situations. Then the analysis of transference. So in both cases of transference, we see like emotional involvement. In case of transference, it is the client who is emotionally involved with the therapist. Like transference is a displacement of attitude and feelings experienced in relations with person onto the analyst in the long past history of the patient. It's like emotional involvement of a client with the therapist. Through this, it is regarded as a technique because through this, therapist is able to understand what actually the problem of a client. It may be positive. Sometimes client may show positive feelings or thoughts. Sometimes he may get angry with the therapist. So counter therapist, it's like a therapist. It's in contrast to transference. It's therapist relations with the client. Here, therapist is emotionally involved with the client. Again, it is both positive and negative. The main aim is to get insight into the past, to understand the individual problem, or to create awareness among the create a more awareness in the client, and to enable the client to work on the problem which he is facing. The goal of psychoanalysis is to achieve an insight, to get the client to know his problems, to know what actually he was suffering from, and gradually he tries to bring the unconscious thoughts, emotions, feelings to the conscious level, and he tries to work on it. Then finally he tries to develop his own coping strategy in order to meet the demands of the society. Developing the coping strategy in the client is very much important. So these are the goals: developing the insight or helping the client to work through his problem, and enabling the client to develop the coping strategies. The schools of psychoanalytical theory. We have Freudian school, we have sub-schools like ego psychology, object relations, and self-psychology. Freudian school, it's a structural model or a drive model. As I told you earlier, it's based on, it analyzes the human drives or human mind in the form of id, ego, and superego, and it's a ig, and it's sexual and aggressive energies. They originate out of it. As we all know, it's the id which likes to gratify things. It does not, it's like impulsive. It does not take into account the reality principles. It works on the principles of, what do you call this, gratification. So the Freudian school mainly focuses on unconsciousness, mainly focus on the structure of the individual personality. It focuses on defense mechanisms. It focuses on how the drive operates, and how all these things operate in unconsciousness, how they influence individual personality, and how they also contribute for how the past contribute for the development of psychological problems in individual. Then the ego psychology. Um, it- the father of ego psychology is Hans Hartmann. It, ego psychology, again, it focuses on the ego. It focuses on the functions of ego. Then we have object relations psychology. Like if you want to understand Aristotle, many years back, he has told that individual is a social animal. We cannot live in isolation. We have to live in society. When we are living in society, we tend to develop a relationship with others. It's the relationship with others or the object which shapes individual's personality. It is a relationship with others which shapes individual's self. It right from the childhood it starts. And the self psychology founded by Hans Kohut. It refers to person. When we say it's a self, it's a perception of self, how the individual is. It's a self belief. So this school of thought focuses mainly on how the self develops and how it operates, and mainly it focuses on the empathy by which an understanding of the patient or emotional understanding is enhanced. So each and every school has got a particular focus. When we come to the difference between the psychodynamic therapy and psychoanalysis, so we use psychodynamic therapy and psychoanalysis interchangeably. There is a slight difference between the two. When we say it's a psychoanalysis, it mainly focus on the past, on the repressed childhood conflicts or the intrapsychic conflicts, and it aims to bring the conflict of a client to the conscious level and try to solve it through getting insight and through working out. And all the problems, when the person is having certain problems, then psychoanalysis tries to look at the past. It tries to look at the childhood of an individual and tries to find what actually the problem he faced in the past, because the problems whatever he faced in the past will certainly influence the present or the personality of an individual. It also focuses, the main focus is on the equilibrium or consonance between ego and superego. When there is a disequilibrium, when there is an intrapsychic conflict, problem arise. When all the three elements are in equilibrium, then the person will be in harmony. Then all these, the unconsciousness, the drives, they all influence the personality to a larger extent. The psychoanalysis is conducted more frequently over a longer period of time. When we come to psychodynamics theory, it does not give much importance to what you call this, the sexual or aggressive drives. Psychoanalysis has given more emphasis for sexual or aggressive drives, but psychodynamics has given very little emphasis on this. And it has given more emphasis on the past relationship of an individual, often of a child. If a person is having problem, psychodynamics mainly look at how the child was having a relationship with his parents, with his friends, with his classmates during childhood. And it mainly focuses on interpretation, in how interpreting the what do you call the unconscious unconscious desires and all. So psychodynamics has got a very precise or a specific goal. If there is a neurosis, it focuses on the neurosis and tries to overcome that problem. If there is a phobia, it focuses on that and tries to overcome that. So we can say that psychodynamics has got a very specific goal, and it is conducted over a shorter period of time with less frequency as compared to psychoanalysis, because psychoanalysis takes a very longer period of time. Thank you.